Hello, everybody. In this section, what we're going to talk about is the thrombus, the formation of thrombus. And this is going to be something that's important to understand because what the body tries to do to prevent the thrombus, which is a blood clot, and the rupture of the blood clot and the plaque into the lumen, is to form a fibrous cap. But this is just a kind of review of where we've gone so far. Here is a normal artery wall, and you have our three layers with the intima, the media, and the adventia. And then what we have here is the buildup of plaque, and then we have what's called the fibrous cap that's going to form over that. Now, the fibrous cap is something that is used to help protect that plaque from eroding or rupturing into the lumen. However, over time, if left untreated, you're going to have a rupture of that fibrous cap into the rest of the lumen, and it's going to form a thrombus or a blood clot. Here's a short video that kind of demonstrates what this slide tried to depict and the rupture of the fibrous cap. All right, so this is a quick video that details the buildup of plaque and eventually the rupture of the thrombus, the plaque, into the lumen, forming a thrombus. So here we have, this is the plaque that's been building up. These dots here are the white blood cells, or the monocytes. Here is going to be the top of the endothelial layer. This is the formation of the fibrous cap, which think of as like a covering, a strong covering that tries to keep the plaque from erupting into the lumen. We're going to talk about that formation of fibrous cap in just a moment. But here's what happens over time, left untreated, how that fibrous cap weakens, and you can see the eruption. Here's just an EKG. Normal heartbeat is happening. You're going to see what's called asystole or flatline when that rupture of the plaque occurs. And that asystole meaning flatline is an indication of a heart attack. The heart basically is stopping. So here's basically the plaque is about to rupture. It ruptures into so now it's ruptured into the lumen, the rest of the lumen. There's the red blood cells. And what's going to happen is now you're going to have the red blood cells are going to attach to this. And it's going to form one large blood clot or thrombus, which is going to occlude the rest of the lumen. Blood cannot get through. And you're going to see in just a moment how basically the person goes into a heart attack, asystole here. So that's ventricular fibrillation, which means that the heart is now not beating properly and the onset of a heart attack has now occurred. Okay, so here's we have just again the overview. So let's move on and talk about the formation of the fibrous cap. So here we have the normal coronary artery. Here's what it looks like when it's fully full of blood, and you can see that it's nice and rich, no blockage. Here's an example of what happens when you start to have plaque buildup. Normally you can see this large circle that should be how large it should be, but because of the plaque starts to build up, it's starting to shrink the opening of the lumen, which makes it much harder for the blood to get through. Here's an example of the anatomy of this atherosclerotic plaque. So again, just to kind of orient you to this, this is the fibrous cap over here with the lipid core. Here's the tunica media with the smooth muscle cells. We're going to watch a brief movie that's going to talk about the accumulation of how this fibrous cap occurs, and then we're going to go into talking about the pathway of how this develops. So this video is about atherosclerosis, and you're going to pay special attention to the formation of the fibrous cap here.
Atherosclerosis is a life-threatening disease that may have begun to develop during childhood. This condition is a process in which deposits of fatty material, called plaque, build up inside the walls of arteries, reducing or completely blocking blood flow. In extreme cases, this disease can lead to a heart attack or a stroke. Risk factors for atherosclerosis include high blood pressure, high cholesterol, tobacco smoke, diabetes, obesity, and physical inactivity. Although the exact causes of atherosclerosis are not clear, many scientists think it begins with damage to the inner wall of an artery called the endothelium.
So here we're in the lumen, we're looking down on the endothelial layer, and then there's that intima, the matrix, the extracellular matrix here of the intima, with these little white lines like that are indicating. So now we're looking down, and there's an injury that's now occurred, and that's you'll see the monocytes coming.
Over time, substances traveling in the blood, such as cholesterol, fats, and cellular waste products, accumulate inside the damaged area of the arterial wall. Chemical reactions occurring within the buildup of material cause cholesterol molecules to oxidize. This initiates an inflammatory response in which the endothelial cells at the damaged site release chemicals that signal a call for help.
So here comes the monocyte. It's been triggered because of the inflammation there that's now in the intima. Here comes the monocyte to come and help clear it out, but in small amounts it's fine, but in large amounts that's when it becomes a problem.
In response, monocytes from the bloodstream travel to the damaged site. Stimulation from oxidized cholesterol converts the monocytes into macrophages. The macrophages eat and digest the cholesterol molecules. As
the macrophage is starting to consume all the modified LDL.
The result of this process, the macrophages change into foam cells, which accumulate to form plaque. As the plaque increases in size, the arterial wall thickens and hardens.
So now this is the protrusion of the, we're in the lumen here, and now you can see that the plaque, this is the wall, the intima, the endothelial layer that's now protruding out into the lumen itself as it grows. Now we're looking down, going down we're going down through the plaque to the tunica media layer made of the smooth muscle cells.
Smooth muscle cells within the arterial wall begin to multiply. Then, most of the smooth muscle cells move to the surface of the plaque.
So what happens is the tunica media here is going to divide the smooth muscle cells, and they're going to work their way back up through the plaque, and you're going to see they're going to form a fibrous cap above the plaque.
These cells contribute to the formation of a firm fibrous cap covering the plaque. Over time, the cap may erode and break open, releasing plaque into the bloodstream. The plaque can flow downstream and contribute to the formation of a blood clot, which can stop blood flow. As a result, limited blood supply is available to the areas surrounding the partially blocked artery.
So what's happened is you can see that the heart here is now turning black, necrosis or cell death is occurring because you have that blockage in the artery that's feeding that particular part of the heart.
Degrading and potentially killing the neighboring tissue. Significant damage in organs, such as the heart or brain, can result in a heart attack or a stroke.
All right, you can see how that kind of spread over time if left untreated. So that's an example of what's happening here. Now we're going to go back and talk about it as a pathway. All right, so that was the video that talked about the overview of the forming the fibrous cap. Here's a few more pictures in terms of the buildup of plaque. Again, this is how large the lumen should be, but because of this large buildup of plaque, here's the fibrous cap. You can see now the lumen has now shrunk quite a bit. Again, here's the fibrous cap, and again, this is how large it should be, but because of that buildup of plaque, you can see how much smaller that lumen has now become. Here's just a picture of some of the plaque. It's been dyed black, but here's the fibrous cap, but here's what it would look like as the fibrous cap breaks and the plaque erupts into it. Here's just another picture as well. And then now what would happen is blood flow is coming through and red blood cells would attach to this plaque. And eventually it would occlude and the remaining opening of the lumen, and blood could not get through, and a heart attack would set in. All right, so here is the pathway of the formation of the fibrous cap and eventual rupture of the fibrous cap. So just to orient you to this, here again this is the endothelial layer. This would be the fibrous cap, this color here. Here we have the actual plaque, and then here's the tunica media. And here is the lumen of the coronary artery. We start with the fact that once you have a buildup of plaque in the coronary arteries, that's going to stimulate the smooth muscle cells underneath it to divide, and then those smooth muscle cells will move to above the plaque to form a strong fibrous cap. The smooth muscle cells will produce what's called collagen, similar to the stuff that makes up the ear, that very strong, dense, but yet flexible material, and that allows for the expansion, but yet not rupture of this fibrous cap. Unfortunately, if left untreated, the plaque will work against the fibrous cap to cause rupture. And how does that do that? Well, inside the plaque, you're going to have some macrophages that are going to produce a protein called interferon gamma Y, IFN gamma Y here, interferon gamma. And what this protein does, is it produces it causes the smooth muscle cell to stop producing collagen. So it reduces the synthesis of collagen by the smooth muscle cells. So you're not making any more smooth muscle cells or collagen to help continue the strengthening of the fibrous cap. At the same time, this activated platelet that's made its way from the blood into the plaque is going to produce a protein called CD40L. And what that's going to do, you can see this is an upregulation. That's going to stimulate the macrophage to release what's collagen degrading proteinases. At the same time, the plaque itself is also going to release cytokines IL-1 and TNF-alpha that we've talked about previously. But these cytokines are too going to upregulate, that's what the plus sign means, is going to upregulate the macrophage to produce collagen degrading proteinases. So what happens with that collagen degrading proteinases, and again, anything with an ACEs on the end, ASES, indicates a breakdown of something. In this case, it's going to, this collagen degrading proteinase is going to break down the remaining collagen that makes up the fibrous cap. So now over here you have the reduction or stopping of the synthesis of new collagen. At the same time over here, you're breaking down any remaining collagen. Over time, the fibrous cap will weaken to the point where it ruptures, and the plaque will now move its way into the lumen of the coronary artery. Meanwhile, the macrophage is going to produce and release a tissue factor procoagulant. A procoagulant is something that causes blood clotting. In this particular case, think of it as like a paint that's going to cover this plaque that's in the coronary artery, and it's a very sticky substance, and it's going to now cause the red blood cells that are flowing to it to stick. And as a result, more and more red blood cells will stick to the plaque, and eventually it's going to build up to the point where it's going to totally occlude the lumen. As a result, as you saw in the first video of this section, you're going to have the asystole, and where the heart attack will occur. So this is an overview of what happens with the buildup or the rupture of the fibrous cap. I would pause the video or after this section. Take a moment and try to put these steps in your own words. Again, there's practice on Blackboard that you can practice ordering these to help with the understanding and learning of the steps. And here's just the word form of what we just talked about. Interesting enough, when a thrombus occupies about 75% or more of the lumen area, the blood flow to that tissue supply is reduced enough to cause symptoms. So interesting enough that up until about 75% occlusion of the lumen, the person may not have any symptoms. And the reason they'll have symptoms is due to hypoxia or low oxygen. At the same time, there's going to be accumulation of metabolic products like lactic acid. That's a sure sign that there's stress on the heart. Interesting enough, about more than 90% of obstruction can result in anoxia, which is the complete deprivation of oxygen and infarction and motive cell death. So in other words, once the occlusion reaches about 90% in the lumen, that's when the person will not get pretty much no oxygen or anoxia to that part of the heart, and that's when you start to have myocardial infarction could ensue, or even cell death. So this thrombus is a crucial factor in the myocardial infarction formation and development. Interesting enough, the majority of coronary events occur where there's less than 70% of stenosis, or the buildup of plaque. And this occlusive coronary thrombus plays a role in over 80% of MIs and about 95% of sudden death in victims. In other words, this rupture of the plaque into the coronary arteries is generally the main reason why you hear people, or the cause of people dying of these sudden heart attacks. So if you ever hear of someone that's died of a sudden heart attack, it's not because they built up plaque over time and it just slowly occludes and blocks the coronary artery. But in fact, what happens is that fibrous cap will be broken and the plaque will rupture into the coronary artery, and that will then block the lumen to the point where now the heart attack ensues. Once you have a good understanding of the steps after practicing putting in your own words, as well as the practice on Blackboard, it's time to do the thinking review questions. Again, take a moment to do these thinking review questions, and then you can refer to the video on the thinking review questions on the fibrous cap to review and to make sure that you have a good understanding of this. All right. The next thing we're going to talk about is the role of HDL, but we'll do that in a separate video.